Well, joining us for more on this, Senior Epidemiology Advisor to the NCDC Director General, Chair Scientific Advisory Group of the Nigeria COVID-19 Research Coalition, also Extraordinary Professor of Epidemiology, University Western Cape, joins us now, Professor Mario Igumbor. Thank you for joining us on the program.
Good evening. Thank you, Millicent, and a pleasure being on your show.
Thank you. First, I'd like you to react to, some of the top stories coming in today, and that is the decision of all the state governors to revive the COVID-19 protocols and collaborate to take appropriate and immediate actions to flatten the curve. Can you confirm to us if Nigeria is experiencing a third wave?
Right. Thank you, Millicent. We certainly have seen a tick up in the number of cases, confirmed cases through our surveillance systems in the last while. It is very apparent that the pandemic is still active, and Nigerians truly need to be aware of the risk and take responsibility. So I do think that the governors coming out is truly coming to terms with the facts. We've got to face the facts here. We can't just bury our heads on the sand. There's a rise in cases in Nigeria, and it seems even more imminent that more cases will be seen in the next couple of days, going by what we see in countries across the world, and more so countries in Africa. And this risk is even higher with the Delta variant of the virus, which is known to be more transmittable. So we think that we certainly have a window of opportunity here to prevent the surge. And, it's really good that the governors have come up responsibly in telling us to adhere more stricter to public health and social measures.
But as much as we need to do that, the science isn't telling us that Nigeria is in a third wave, is it?
Well, like I have put it, we define waves of the epidemic as a rising surge in numbers. We certainly saw numbers dwindling from April, May this year, which in our parlance reflected, the end of the second wave, as it were. But in the last couple of days, we've certainly seen uptake. Treatment centers that had 0 patients are beginning to see patients come in. In clips we saw just before your show started, schools around Lagos area are beginning to report a fair number of cases being picked up. We need not wait to have very high levels of infection and to begin to take action, especially in the wake of increasing number of cases as we're seeing more recently. If we can nip it in the bud soon enough, we're at better place in controlling the epidemic.
Let's talk about the work you're doing in Delta and other states. I believe you're taking samples of households on the seroprevalence studies. How are they reacting, and what are the numbers telling you?
Well, thank you, Millicent. Building on work we have done in a couple other states, we started in Lagos, in Enugu, Nasarawa, and Gombe State last year. And early this year, we were in Sokoto, in the FCT, and in Kano. We have now come to Delta State and to again undertake studies to find out the levels of antibodies across all 25 local governments of the state. We enumerated about 34 areas, and so far we have been able to recruit in excess of 2,000 individuals. In these individuals, we have tested them for COVID and drawn blood samples to be able to pick up antibodies for the SARS-CoV-2 virus. And we'll be testing these. We're still in the lab, and we've been very happy with going into people's homes and kind of talking to them and inviting them to participate. And it's been quite good to see the response we have got. And we're looking for the next couple of days and to see that we get an adequate number of people who would volunteer to be in the study and get their samples taken. We are also in the households learning about some of the behaviors they perform related to COVID and asking questions too about their predispositions to taking the COVID-19 vaccine. So we're learning a lot just being in the field in Delta State, and we've been very pleased with the participation so far.
And hopefully when the results come in, you'd also share them with us and with Nigeria. We appreciate your time on the program, Senior Epidemiology Advisor to the NCDC Director. Thank you so much, Professor Mario Igumbor, for joining us on the program.
Thank you, Millicent. It's been a thank you.